Resolving pulmonary artery intimal sarcoma via the standard of care combined with metabolic therapies. Patient, Dennis Stacey. Abstract. Objective. To establish a precise account, inclusive of detailed medical records and supporting scientific research publications, of precisely how independent, self-administered metabolic therapy in combination with the standard of care can directly contribute to resolving and preventing reperfusion of disease in a pulmonary artery intimal sarcoma tumor model, specifically addressing metastatic disease progression to the lower right lobe of the lung. Setting: surgical tumor resection and independent self-administration of the Dr. Seyfried Press Pulse Metabolic Protocol. Interventions: surgical resection of primary tumor and consistent control of metabolic response, as validated daily in the form of measurably decreased blood glucose in the 65 mg per deciliter range, along with elevated blood ketone bodies in the 2 to 3 millimolar range. Via a precise daily accounting of fat grams, protein grams, and carbohydrate grams consumed, in relation to total calories and the ratio of fat grams to protein plus carbohydrate grams. Inclusive of hyperbaric oxygen therapy, 3 days per week at 2.2 AT for 90 minutes per session. Mechanism of action: upregulation of reactive oxygen species, as well as the use of novel substrates such as mebendazole, dosed at 5 mg per kilogram body weight, 3 days on, 4 days off. Mechanism of action: microtubule inhibition. And 6-diazo-5-oxo-L-norleucine, DON, dosed at 0.2 to 0.4 mg per kilogram on day 0, day 4, day 8 and day 12, followed by a 2-week break, then repeated at interval. Mechanism of action: glutaminolysis inhibition. Primary outcome measures: decline of tumor dimension, decline of standard uptake values as evidenced via PET, CT scan, along with prevention of metastatic disease progression and reperfusion. Results: decline in both tumor burden and standard uptake values. No new disease progression. Conclusion: while the Dr. Seyfried Press Pulse Metabolic Protocol does not constitute a replacement for standard of care antineoplastic therapies, given that metabolic therapies are primarily targeting mitochondrial competency rather than nucleic mutations, these preliminary results suggest a potential for clinical application which merits further research. Introduction and methods. Preliminary findings. As of October 2022, a 48-year-old male presented to physicians with shortness of breath, lethargy, and limited capacity to exert himself, initially presumed to be suffering from a pulmonary embolism. Further diagnosis via echocardiogram and imaging, MRI and PET, CT, revealed a 50% ejection fraction along with a malignant mass measuring 6.6 centimeters by 3.4 centimeters, with a corresponding standard uptake value of 14, along with a presumed metastatic lesion to the right lower lobe of the lung. Treatments: a surgical resection achieving R1 margins of the primary tumor within the pulmonary artery was performed, with subsequent pathology demonstrating that the removed tissue was MDM2 positive and of a high mitotic value. Remarkably, the patient declined recommended post-surgical standard of care interventions in the form of doxorubicin and ifosfamide, instead opting to pursue the Dr. Seyfried Press Pulse Metabolic Protocol independently. Survivorship with the standard of care was estimated at 18 to 24 months. The Press Pulse protocol consisted of a precise daily accounting of dietary grams of fat, grams of protein and grams of carbohydrate consumed, at a caloric density in deficit from basal metabolic rate and total daily energy expenditure, and at a ratio such that for every 2 grams of fat consumed, correspondingly 1 gram of protein plus carbohydrate was consumed. The metabolic effects were validated via twice-daily measurements of blood glucose and blood ketones, pursuant to achieving therapeutic targets of 65 mg per deciliter blood glucose and 3 millimolar per liter blood ketones. Additionally, stress management in the form of massage, sauna, walking, resistance training and meditation were consistently included on a daily and weekly basis. Furthermore, hyperbaric oxygen therapy, 3 days per week for 90-minute sessions each, at 2.2 AT and above were implemented, contingent to glucose levels being in the therapeutic zone of 65 mg per deciliter and ketones in the 2 to 3 millimolar range prior to entering the chamber. The repurposed substrates mebendazole and fenbendazole, microtubule inhibitors, were implemented at 5 mg per kilogram, 3 days on, 4 days off. As well, oral dosing of the novel substrate 6-diazo-5-oxo-L-norleucine, DON. Mechanism of action: glutaminolysis inhibition, was implemented at 0.2 to 0.4 mg, dosed on day 0, day 4, day 8 and day 12, followed by a 2-week break, prior to repeating the interval. Supplements such as metformin at 1,000 mg per day inhibits hepatic gluconeogenesis and intestinal glucose uptake, and berberine at 1,600 mg per day inhibits peripheral tissue glycolysis, were implemented as an adjuvant method of glucose control, in combination with precise nutritional control of glucose and ketone response. Results: tumor burden decreased slowly over time, as evidenced via PET/CT scan, with the most recent imaging demonstrating primary lung lesion has decreased to 4 mm. No corresponding standard uptake value is associated with this lesion, nor the lesion in the lymph nodes, and there are no new or progressive lesions detected. Discussion: while this case represents an atypical therapeutic choice by a patient, it does demonstrate the near-term effects of metabolic therapy when combined with the standard of care in managing what would otherwise be a near-uniformly fatal disease model. Ostensibly, continued glucose control via precise administration of nutrition would be warranted prophylactically, pursuant to managing disease recurrence, as would frequent PET/CT imaging to monitor clinical status.